Cool. I'm just waiting to see. There it's showing the red dot. Awesome.
You can hear it.
Yeah, I can hear you.
Alrighty. Happy Friday, everybody. My name is Morgan Carver. I'm from Connector DRX. I'll be conducting today's training today. I'm really excited to speak with you guys. I spoke with a few other folks from HPM or HPM, no and in there, earlier this week. So I'm excited to go through today's training. If just as kind of some housekeeping items, this will be recorded. So any questions, things you need, be sure to bring those up. That'll be captured and you'll have a copy of this recording to play back and review. Simple request if folks could stay on mute, that'll just help kind of keep things flowing and help any kind of audio quality issues. And then I think just due to the size of the group, I'm going to do my best to answer your questions at the end, just so I can make sure we can address everybody's questions. So I think what's been really useful in the past is it looks like folks are already utilizing the chat. That would be a good spot to ask questions, and we can always review stuff at the end. I always save time for that. So what we'll be learning today is kind of going through a review of an end-to-end training as an agent, working with a beneficiary, kind of working through the shopping, quoting, and enrollment process. There will be certain instances I'll point out to give you a sense of what the consumer sees from the beneficiary's perspective. I think that always really helps kind of seeing directly what our members see can really help us from our side as far as training and supporting them. So without further ado, I'm going to start with logging in, of course. One of the first steps I like to point out is the dashboard. So from the agent side, as far as some tools that are useful, your dashboard is going to be kind of that main space to have your book of business tasks. So follow-ups with your beneficiaries, you can see it populated down below. So I have a quote to follow up on with a member. I have a due date. If I had enrollment, any other kind of categories here are captured. The mymedicare.gov connection, I'll speak to that more further on in the training, but it's essentially kind of like the blue button. It's a way to request a bulk download of prescription data if your member uses mymedicare.gov. Some other useful tools from the dashboard are going to be things like the reporting feature. There's a few different types that you can report on. This ranges between enrollments, HRAs, and scope of appointments. So depending what types you need to report on, that's where you would make those adjustments, identify the agent username, and then you would submit and select that specific date range interval. You can work on 31 days or less. So that's just for the tool. And that's where you can adjust the dates there off the calendar right there. One of our upgrades in the last year was our agent training materials. So our learning management system, also known as the 360 library, this is going to contain specific courses and training material relevant to our sites, and some of it kind of the processing too. So, there's a few different ways to kind of handle this. If you want to just search a specific topic, you can go to the search bar up at the top right and start looking for specific filters and types, as you can see, kind of pre-populated here. But say I want to learn how to do a scope of appointment on our platform, I would just type in SOA, find that relevant material. And in this example, I had already started, so you are able to revisit training sessions. I can see the progress I've made, the different types of activities that make up this training. So it looks like some Q&A, some open field text and videos. We can see the average test score, a summary of that training, just to show you how it starts. That's where I can pause the time. And I've also bookmarked this in the upper right corner. If I want to navigate back and go to maybe some pre-organized or filtered, if you will, kind of different learning prompts, I might go to the left-hand side and go to the assigned group. This is where anything relevant to kind of an agency administrative level, but also agents as well. These courses will be more filtered and kind of tailored down to that topic. So You can think of paths here as the sort of book on the shelf, if you will. So this would be like new agent training, kind of like a larger book of course material into one. And then if you go into a specific course, think of that as like the supporting chapter of the book. So these get a little more granular, a little more specific, depending on what you want to look at, maybe enrollment exports, user guides, agent call recordings, another good example, or SNP filters. As you probably already noticed, on the right-hand side is where we have our news feed. So this is kind of across organization activities and updates to different trainings. So you can read that. The bell icon is going to be our training notifications. So this will show, well, it shows right now I have 4 remaining to do. And then I can navigate to see the results of those trainings under my profile picture, my specific playlist for the courses, things like that. Another useful tool I'd like to point out, particularly for agents, is the Create Learning Need. So we love suggestions. Our platform is also based on a lot of the feedback we get from our agents out on the field doing the work. So if there's a particular problem you're facing that creating a training for us you think would help a lot of agents, we'd love to hear from you. There's a pretty generous character limit, so please write to your heart's content. We love feedback. Okay, so now I'm going to jump back to the broker site. One of our other tools is PlanSmart. So that's an analytics tool that basically pulls and identifies cost savings for any kind of at-risk beneficiaries. Other things to note from the dashboard page, you can always navigate back to the dashboard near that gear icon. You can jump ahead and look at plans. This would require a zip code if we don't have a beneficiary in context, and I'll speak more to kind of what that means through the site experience. Then we have our search in the book of business field, as well as searching for agents and the profile creation for beneficiaries and agents. I'm going to touch on what the agent tools are here before we jump ahead. So my name as the agent is up here in context, which shows another way to kind of go through navigating the site. If I want to jump to reports that way, I can do that, as well as PlanSmart and the training materials we just saw. Things like account overview. Account overview is going to have important things like the shopping link, so also known as the PEARL or the personalized URL. So that personalized link, when distributed to a beneficiary, if they're interacting and doing shopping, any kind of work on that link, that's a way to tie credit to you as the agent towards closing that enrollment because of that unique URL string that beneficiary used to do their shopping. So that's where your 2025 link will be. In the last year, we made a partnership with RetireFlow. This is an optional sign-on for agents who are interested to learn more. So you'd follow the sign-up link and learn more about enrolling in the platform of RetireFlow if you're interested. It's a 10-question short survey that automatically updates client profiles with up-to-date drugs, pharmacies, doctors, and hospitals information. So there's more information there. I also have a couple videos on the 360 learning if you'd like to learn more. And on the right-hand side is where you would upload your profile picture. I'll be sure to point out as we kind of go through the training today where your profile picture shows up in those communications directly with the beneficiary. So scrolling further down is when we get into your credentials, your personal information, the contact information, account, selling permissions, that kind of information. Just to kind of take note of, I'm looking through a lot of this on this page as an enroller at an administrative level, which is why some of this might look slightly tailored different. The full scope of our roles is defined here, as well as in our documentation for all these different types. So if you're just doing kind of quoting, that would be just some of those administrative differences I like to point out. Further down, your selling permissions will already be set up for you based on your NPN number, but just as a sense of where admins are looking at selling permissions and things, that's in that lower part of the site here on account overview. So I'm going to go ahead and place a beneficiary in context. Now, The reason why that's important is so we have the member in context to start making those updates for their doctors, start shopping for plans, enrolling in a cart. So we need to identify them in the book of business through this search feature. Because in this use case, I'm going to work with an existing, actually, I'm going to create a profile, but I'll show you what this looks like through the search. You can search for members based on any of these credentials. Just to kind of point out what a personal code is, that is that unique code identifier that is attached to the member as kind of a way to save progress. So I'll visually explain what this means. So if the member is on the consumer-facing site, which I just navigated to, if I place in a zip code as the member doing my shopping process, and let's say I haven't worked with an agent yet, I can speak with the licensed sales agent through this prompt here. And this is that personal code that I can pull right here and share with the agent to resume and save any progress I've done as a beneficiary shopping before I'm paired with an agent. So that's where that personal code would be pasted into here. I'm going to search based on email and just show you kind of what the results look like. So what you get is a download of your book of business. So obviously it'd be like more profiles here instead of maybe just the one, but you could download this into an Excel. You would have information from the member name and contact information. This would show their status, whether they've enrolled in a plan, which would be applicant, or if they're a registrant, which is prior to enrollment. They haven't enrolled in a plan yet, but they are in the system. This would be the agent of record and the last updated date for this profile. These sorting capabilities, the default would start at last name, but it also goes through status, last updated, and agent last name. So depending on how you want to work with your book of business, I would say sort it to what makes the best sense for you. I'm going to create a new profile and just kind of show you what that looks like for a member's information and what we're collecting. So starting with zip code, anything on the site with a red asterisk is going to mean that it's a required field. Let's type in the rest of their name here. And then we have date of birth. So those are kind of the 4 required credentials. For today's use case, we'll want to make sure we're also gathering email, phone, throw in an address. And all that kind of personal contact information will be on the left-hand side in this little outline box. On the right-hand side is where we can see the agent of record, that RetireFlow integration from the profile level, and then any kind of outstanding tasks tied to scope of appointment. You can also collect ad hoc kind of notes or tasks here. Tasks collected here will show up in that other category we saw earlier from the dashboard level. So you can just add a due date, add a task description. And that's how that would work there. If I scroll down, this is when I jump into things like the eligibility checker. So making sure I capture that member's MBI number, their Part A, Part B effective date. And I can also allocate for any kind of extra help paying for prescription drugs, whether it's a Medicaid qualifier or any other applicable source. We also have the state Medicaid eligibility check up here as well. And then things like quote history, enrollment history, all those activities on the member profile would live down here, which I'll circle back at the end of the enrollment and we'll see how that populates in the historical information. You're seeing the guided workflow down below. You don't have to go through the guided workflow. That's just kind of one way of logic to navigate the site. If you want to do kind of the choose your own adventure, as I like to call it, you can go to the same list of features out in the recommended workflow, but that would live at the upper right-hand corner, again, with that beneficiary in context. And how we can always check is if that member name is up here. So we can go to their profile, jump ahead to scope or preferences, as well as the plans and cart page. For today's demo, I'm going to use the recommended workflow. So if we continue to scope of appointment, Now, there are several different ways to capture scope of appointment. So I would just advise to use what's the use case for you. Um, just to kind of explain some of your options. If it was an in-person SOA, you would click this hyperlink. This would generate in the same window, the same session, and you would just complete those steps with the member side by side to reflect that that's in person. There's also the by phone option. There's also printing a copy of the form or uploading if you already have a physical copy of the form. You can also do that to the site as well. You also have the ability to text and email. I'm going to show you the emailed example of the scope. So we can already start to see a status change here in the back, kind of grayed out. I'll show you after this modal is closed. Now the modal populates to show confirmation that this has been sent. And it's also showing form kind of logic here to initiate a task. So just kind of helping support book of business and managing follow-ups for the agent. I'm going to go ahead and add a task. I'll be sure to get to it if I have it to do. And if I jump to the member's perspective, I'm going to refresh the page and see what that beneficiary receives. So this is how the email would come in: scope of appointment form, logo from HPM. So we have that branding come through, the member's name, that little introduction, then a link to the complete scope of appointment form. You'll also note that the agent's contact information, profile picture, phone number, if supplied, all of that would populate here next to your NPN. So the member is able to see who the email is coming from as well. And once they select that link, this is taking them to the consumer-facing instance of the site. I think a shorthand way to kind of think of it is all of our sites talk to each other. So what's relevant for that user experience is going to show up. So from this link for the SOA specifically, this is the confirmation for that appointment form that the member would fill out, check all the products that are of interest to discuss, confirm any kind of contact information for the member, and then checking that everything is correct and true and has been reviewed. So once I submit that, I'll switch hats again and show you what the agent sees as their next steps. This is just showing that confirmation and that the broker will get in touch with the member soon. So if I refresh the page from scope, I'm going to see the completed status, as well as the date, a quick summary of the plans of interest. And then I'll follow the prompts as the agent to select complete form. As you can see, as a reminder that to be completed by agent, parentheses here, just shows those other steps I got to do. So my initial method of contact, any additional notes, plans represented during the meeting, and the date the appointment was completed. This is another just confirmation that everything is true and accurate and authorized as a signature for scope. Once I submit that, I'll have a confirmation that'll populate as well. And we can also see that at the profile level. So the scope of appointment page will show that completed stamp with the confirmation number. If I need to view a copy of the scope and download the PDF, you'd follow this little paper icon and the link to view. Now that that's generated as a PDF, I can open it. It's the exact same copy of the form, but in PDF format, so I can download that as well. From the member profile, I'll just show you what that activity looks like. Same thing, that completion, plus the date for scope of appointment at the profile level. Let's go ahead and work through the preferences flow. So preferences, these are optional, but I will say they're very helpful in terms of gathering that upfront information pertaining to any new providers or prescriptions to capture and make sure that plans are including those plan benefits, but as well as those specific providers or types of prescriptions for the member. So guided help is really meant to attain that kind of upfront personalized information. So the way this works in the flow is the zip code based on the member's address, that's automatically pulled. We can then isolate specific coverage types that the member is interested in. I'm going to select medical and prescription drug. And then we can see that the extra help was already allocated here. So we have Medicaid captured, that's from the profile level earlier. And then I'll just follow the prompts in the lower right for that continue to work through the form. So this is where I can gauge through guided help the health status of the member. Their age is auto-selected based on their birthday in the system here. And to see those estimates of medical costs for the specific benefits and uses, we can also account for those here and make updates here for a more accurate projection of any of these use needs for these specific benefits. So I'll just make a couple edits here and add some increased use cases. And we'll change that amount and save. And we'll see further on in the training where those costs populate and where we can see a preview based on a plan detail in context. So I'm going to continue and just kind of work through the rest of this flow. So if I start to type in a provider name, I can also filter specifics like facilities, value-based care providers. You can see the specialty in the italics under each of the providers' names, their address, their contact information. If the provider is at multiple locations, the system will also locate that. So if I add a provider, say, with multiple locations, I can select multiple or just the one applicable if the member doesn't go to multiple locations for that provider. We can also capture if this is a PCP as well as a new or existing patient for the provider. Once I've made those designations, I can see that quick summary here on the provider, as well as the primary care status and the new patient status. Add a non-PCP, we'll see how this is displayed. Next, for prescriptions, I touched on this a little bit earlier, but that connection to mymedicare.gov, it's a built-in button to send an email invitation to directly log into that member's mymedicare.gov. So simply the member would take that email, follow the link, and log into their mymedicare.gov account. Once doing so, there will be a bulk import of the last 12 months of prescription data. And you'll see real-time access here to see if that action was completed by the member and if they did that login. Like right now, the email was just sent and we're waiting for that access to their mymedicare.gov info. I'm going to start filling in kind of a manual example here of a prescription. So you would start typing in that specific script. You would select the applicable dropdown, the dose and form, as well as quantity and frequency. Then you would just simply add. And add another prescription here. So depending on the forms, it'll also show the applicable packages or dosing, depending on if that's an injectable or tab, any of those differences there. You have the options to get really specific on that prescription. In the case of maybe a brand specific prescription that might be more expensive, our form logic also knows how to find generic equivalents that might also enable a cost savings benefit for the member. I will say we aren't providers, so I think a way to use this intentionally is to send maybe a quick quote list of the prescriptions included here. So I'll say yes to including the generic equivalent. And in that use case, your member doesn't have to write down the name of that new prescription. They can take this to their provider, and it really empowers that member to have that transparency, that accuracy. And it's a benefit for you as the agent because you're advocating for cost savings with the member, which we know is always a good thing to do. Through the rest of this kind of guided flow, our last stop is going to be pharmacies. So it's a very similar kind of layout to the provider page. We have that zip code and context, and then there's a list of pharmacies that are pulled based on the zip code, but we can also be more specific by a pharmacy name if the member has one in mind, or we can kind of go through the list based on the general zip code. There's also a list on the right-hand side, this other tab for digital pharmacies. So there's a variety of different digital pharmacies to add, and you'll see that summary of the 3 selected in context here at the bottom. So as far as the primary pharmacy, that's just a designator to populate kind of the default list of drug costs. So I'll show you what that looks like from the cost page when we get to the plans page. So once this loads, we'll see like zip code, the year, as well as different tabs separating the plan types. So kind of starting off, just to orient ourselves, we can see the plans available that we are licensed to sell within this zip code and for this year. We can also view non-licensed plans. I know that's important for research purposes sometimes, so in adding that, you just follow the hyperlink logic. An additional filter will populate to go back to seeing just the licensed plans. And as far as the tabs here, this kind of starts with your MAPD and then goes through to MedSup and your ancillary plans from left to right. If we need to isolate specific plans by different filter credentials, you have a variety of filters here. You can also switch to isolate SNP plans with this filter. On the left-hand side, you can also put specific like provider information, the deductible, out-of-pocket maximum filters. You can also look for specific carriers or plan subtypes, the preferences. All that preferences information kind of throughout the site experience will show a quick summary, and you can always navigate back to make edits. So it's, again, just super intentional in the design to support agents for any kind of step in the process where you might need to change or make an edit. You can still do that. One of the other updates that have happened to the plan cards, we've kind of simplified the stack a little bit. So we tried to, I would say, kind of design things to call out the most important information at the start. Additional plan details like your add-on coverages, those are going to be in this drop down here, the view more details link, and then we can see that quick summary. We can also view the additional details pertaining to those add-on coverages in these view detail drop downs. So if that is part of that plan, that's how that would display. And as you can already start to see the providers that are in or out of network, prescription information for on formulary or not, and the pharmacy designator. So switching through pharmacy pricing, super easy. You just select the pharmacy under the cost based on tab. And this is kind of throughout the site experience. So it starts kind of generally at the plans list page, but this is also available throughout the site depending on where you're at. I'm going to go ahead and generate a quick quote. So as you can already start to see here, that gray button on the right-hand side is where we can add these for the quote. I'm going to try to pick 3 different plans, and then I'll scroll back to the top. That summary here is going to show the monthly plan premium amount across the 3 plans. You can do 3 at a time. And then these are hyperlink specific to go to that plan. If I select the send quote button, a modal will generate. This is where I can email, text, or send in both methods of contact a copy of the quick quote to the member. It's a simple kind of 2-step process. So the first initial method of contact, it's going to send an authorization code to access that second step, which is the secure link to the quick quote that you're generating here in this example. So I'll show you what the member sees in a minute. This is part of that modal though. So as far as emailing, texting it, I would check what's going to be applicable. It's not a real number. I'm going to stick to the email example today. And then your additional message, this is kind of pre-populated, but it's an introduction into what the quote is, what's going on, that kind of thing that you can always add to this. Obviously something more professional, but look at your quote. I think that gets the message across for today's training. And then this also shows kind of a quick summary of the plans included, as well as the pharmacy designation. So again, just that first round of costs, I'm going to go off of Mr. that to be the cheapest for estimated drugs for right now. So if I send the quote, follow that little yellow button. Another modal will show the confirmation. So this is just confirmation that this was emailed successfully to the member. The authorization code, this is also historically available on the member's profile. So if this gets lost in emails for some reason, you still have that historical data. Or you can always send a new quote. Whatever is kind of simple for you and the member, I would say, is the best approach. Now, again, just kind of keeping tabs on things. If a task follow-up is relevant for me, I can go ahead and add the task, or I can bypass that. I'm going to add the task because I don't mind the reminders. Once I close that modal, I'm going to jump to the member's perspective, and we'll see what that email looks like. So the first email is going to have the authorization code. So that's where we see that introduction. Copy the code, go back to the second email as the beneficiary, and then I follow that link. Selecting the view quote link will take me to the consumer-facing instance of the site. So in the lower left-hand corner is where I would type in that authorization code and select continue. Now, just as a reminder, I'm looking through the beneficiary's perspective on receiving a copy of the quick quote from my agent that we generated earlier. So as I scroll down, if I get questions or I get confused, I can get in touch with my agent here. This is where their phone number and email would populate. My account summary and information, things like my preferences information, I can make adjustments to as the beneficiary. So again, just really intentionally, this is designed to empower, supporting the beneficiaries. So having that kind of transparency and very similar layout, I think, is intentional, so we can better serve our clients. And looking through your preferences flow, you can see that summary there as the member, and then I can pick a plan or make some comparisons, right? So as the member, I can look through the costs. I can also compare these plans further and also shop all coverage types. So if I'm curious about some of these other definitions here, I can learn more about that as well as shop. From the member's view, I can also do a comparison side by side, which I'll show you from the agent's perspective. It's fairly similar. This is just more watered down because obviously we're not given agent credentials to consumers. So just kind of thinking through, that's the thinking behind that design there. Jumping back to the agent side on the broker site. Now we're going to look into plan comparisons. So I'm going to select through this checkbox here, and then it's already generating that compare now, but I'm going to select 3. You can select 3 plans at a time. I'm going to look for another plan here. Oop, not add to cart. Comparing. Let's go back to the plan list page. I'm jumping ahead there. Okay. Let's see. So just as an example, it did retain my comparisons here, which makes that nice in this session. So let me add. There we go. And there's never a redundant question, so you're good. I was just noticing in the chat, this is being recorded, so you will be able to watch this training playback, be able to pause, rewind, whatever you need, definitely. Okay, so now that I've selected a few different plans and context to compare, similar as you probably are kind of already taking note, same kind of layout, again, just intentionally designed to make this easier in discussing those plan options too with the member. One of my favorite tools, and it's a very simple tool, but I like simple tools, is the show plan differences. When you check this box, as you can see below, any numeric value here that is different between the other plans will show a highlight. So that'll help kind of at a glance isolate where things are apples to apples comparisons, or if we're starting to look at bananas and jumping to vegetables here. So anything you need, to kind of better make sense of the cost savings, the benefits, and whether that's going to be a good fit for your member. You can really isolate that through this page. Anything like the preferences information, that's going to be towards kind of the last 75% of the page towards the bottom. So that summary of provider, prescription, whether any of this is covered in or out of network, you'll see those statuses there. The optional add-on coverages, if applicable, you'd see that extra information. So again, it's just going to be that carrier specific add-on coverages. Same with the plan documents. So your summary of coverage, your end of benefits, that kind of information for plan documents is in the bottom here in review details. So let's just say that so far it sounds like the best fit plan is this WellCare plan. So I'm going to go ahead and view the plan details for more information. I'm going to take a quick sip of water here. So when we get to the plan's details page, think of this as a closer kind of zoom in to this specific plan, right? So your plan details, the cost of prescription, the health costs from those benefits we looked at earlier, and then kind of a calendar view. Those are all separated by different tabs. So depending on what you need to review next, that's how that's organized. Now from the plan's details page, the first stop is kind of looking at the specific costs. Then we go into the benefits and medical coverage specifics. So depending on what you need to look at, this is all outlined here. So definitely a lot more detailed information as you go further into the site and into the plan. Your pharmacy coverages, your 1 month and 3 month supply for pharmacy cost, that's also in this section. And then we get into that preferences flow again. I was picking random providers, so I'd say the odds of them being in network, they would just show in network if they were, but just kind of pointing that out. It'll show that status in quick summary, as you can see here. It's like all the prescriptions are covered, which is great. Pharmacy, and those plan documents, right? So star ratings, formulary list, any kind of extra information, carrier specific would be under plan documents. And again, right, you may have already noticed this on the cost base tool. This is accessible through the detail kind of the plans and the plan list page. So you can still change this and see that real-time cost estimate in the plan. The prescriptions tab, this is where we're getting more specific information tailored to, the prescriptions, whether they're a covered prescription, non-covered, but also where they fall in the tiers. So the applicable tier will correspond there, whether it's a preferred generic, select care drugs. You can also see the retail costs, initial coverage, and catastrophic, as well as the dosing and form. The third tab is going to be in the health costs. So we made some of those adjustments earlier, if you remember from the first part of the guide to HealthFlow. So we made some adjustments here. It looks like emergency care makes sense. It's a little bit more expensive, so that went up. But that'll give you that estimate of cost in the subtotal and the estimated remaining out-of-pocket costs as well. The last tab is going to get into total estimated costs, but more of a calendar view. So this is where we can look specifically to the month with the specific effective date in mind. So obviously we'll be looking at January 2025, and then jumping ahead to projecting into next year. You can also see from this day and time, right, the projected cost we're seeing for next year. So you can drop these, minimize them, whatever you need to just kind of evaluate the information. So let's say that after evaluating this a little bit further, this looks like the best fit plan. I'll go ahead and add this plan to cart. And that was just showing that I had already added another plan to cart, which is why I was seeing that message again. So you can always change a plan that's already in cart. We shouldn't be seeing a scope reminder. So I did complete that on the other end. I'll just take note to check on that. Sometimes the staging sites show funny things, so I wouldn't worry about it too much. And then if there's Next step is going through the hospital indemnity plan. You can shop for those here. And then from the carts page, we're going to see that specific plan summary and context, the monthly plan premium at a glance, and then we can also capture how the form will be completed. They have a couple different options. You can send this to the beneficiary, kind of pre-filled out, they review, and then they sign it, or you can complete it by yourself. So if you're sitting maybe with the member or you're doing a recorded call with them, you could do that as well. So I'm going to show this example. And you'll select the continue to apply button on the right-hand side. And this is going to take you through that specific plan for enrollment and redirect it through the carrier's enrollment form. So as this generates, I think it's something to keep in mind is that every carrier has different requirements. I know from this experience, we're looking at a modal of the pre-enrollment statements. This basically is part of CMS compliance. So anything on the pre-enrollments modal is going to be relevant to, do I have permission to record this enrollment? You can see the agent notes for the recorded calls reminding you as the agent to ask the following. Some other agent notes that are important to you, ensuring that beneficiary knows all the costs associated with their benefits. So you would review this with the member. I will say we upgraded this and got rid of the line-by-line checkboxes. So this has gotten a little bit easier there. You can select just one checkbox and then see the required disclosures. So again, just following the compliance here, going through that in the training. So it looks like in this enrollment form, it's 6 different steps. I've seen 5, I've seen 7. It just kind of depends on the carrier requirements. So you'll want to be sure to fill out any of the important fields. And of course, a required field is still going to have that red asterisk as the indicator. So it looks like this one is starting with contact information. So I'm going to go through this and make sure I fill out everything required. So going into their contact information, make sure that's all relevant. Their preferred method of contact, permanent residence. This is where we would capture the eligibility information. So the member's Medicare number, their Part A, Part B effective date. If there's additional prescription drug coverage, we can also account for that. If they're enrolled in a Medicaid enrollment program, we can also make note of that for their state Medicaid program. And then we jump into ethnicity and race, as well as one of the new additions to the form, again, in just CMS compliance, gender identity and sexual orientation. We can also account for accessibility formats, employment information, also physician selection. And if you already kind of noticed this too, our enrollment forms got a refresh as well in the last year. So that upgrade, we've tried to make this a lot cleaner in the way it's stacked. I think someone said it kind of feels like a paper form, which I think is a cool way to think about it. I definitely see that. Then we go into reviewing that statement of understanding. So again, just making sure we're capturing everything accurately and compliantly. So capturing what the relationship is to the person enrolling, checking that this is correct, more disclaimers. I'm going to continue, and there will be a review before I submit this form as well. So the review is nice because it puts things in kind of a little stack. So if I know I'm pretty good, I've already looked through kind of current information, I can jump ahead and close or expand these depending on what I need to review. It looks like this has a voice signature option as well. I'm going to pretend I'm still on a recorded line, maybe through this whole enrollment. Just go ahead and submit. And then what we're going to see is application confirmation. So what that's going to show here is the status of that pending approval, of course, but that is showing confirmation that the application's been submitted. So it shows kind of your next steps, as well as the application details. This is what gets sent to the carrier. We can see the member's name, their address, the submit date, and the confirmation number for this application. You can see a quick summary of what plan it was and view a copy of this. So in following the hyperlink here next to that paper icon, this is a PDF copy of the application itself. So I'll show you what that looks like. This gives you, every step of the form, what was filled out. And I think what's also useful is that preferences information we captured earlier from guided help. That's also included in the last couple of pages here. So it breaks down what was discussed. So if you need those receipts, you can go back and say, I got the prescription information we discussed, the member, pharmacy providers, that's all here, and that's all captured. I'm going to show you what that looks like now from kind of a historical perspective. So we can see that that activity now has taken place. The quote was sent with the associated date and timestamp to that member's email. The plans in the copy of the quick quote, and as promised, that authorization code, you still have it. So that's historically tied to the profile, as well as a quick summary of the message and even the fill-in that I added as well. When we get into enrollment history, that same kind of logic is captured. So we have the name here of the plan specifically, monthly plan premium, as well as the submitted date and timestamp, and then that enrollment confirmation number as well. And we can view a copy of the application here also, not just from the submitted page. All righty. Well, this kind of covered the end-to-end training. With the remaining time we have, I'd like to open it up to questions. I didn't see any added to the chat, so folks are welcome to use chat. Or if you want to unmute yourself and share a question, I'm also happy to revisit a part of the training as well.
So with the recorded being saved, like how do we gain access to it? Will it be distributed by? Do we need to send an email, or how does that work?
So as far as the recordings, if you use an RCall recording tool, which I'd have to confirm with Caroline, I'm not seeing that feature on this part of the site, so I would just have to confirm if that's part of the subscription for this part of the site. But the call recordings themselves, they're saved as MP3 files, and those retain on each of the profiles, but it would be an admin that would be able to download that. So you'd have to be an administrator to access it.
What I should have clarified that. I'm talking about this training being recorded.
Oh,
yeah. How do we gain access to it? Will it be emailed to us, or is there a point of contact?
Got you. Thank you for that. And I just saw the updated chat. It's not call recording, but I think we got clarified. It looks like that we got the answer in the chat. That'll be hosted, but we'll be sending that out after the recording is done processing. So yeah, you'll definitely have access. Other questions? I'll also just throw another reminder. If there's anything that you wanted further time on from the agent training material side, again, you can navigate to that through the dashboard here on the right-hand side, or go to your name in the dropdown for agent training materials. That'll take you to this link for our 360 learning. I think some folks made it late to the calls, and this was at the beginning, so I'll quick review the 360 learning. But there's a few different ways you can search for specific topics on our site, or you can go through more of a guided flow through the training courses in kind of a longer path, or a specific course at more of a granular, maybe feature level. And it looks like, just to take note of, that the copy of the recording will be made available through the HQ Gold Key. So that's where that will be. I know that was packing a lot of information. So again, just want to hold some space if folks have questions. Okay. Well, if there's no further questions, I'll kind of take that silence as you guys got it. I want to wish everybody a happy AEP. Thank you. I know it's been a busy time, and I hope everybody has a great weekend. Thanks for spending time with me today.